everybody, it's Jenny from Bad Ed again. So the next procedure I'd like to go over with you is dressing a dependent resident. So when you're taking your state skills test, if you get dressing a dependent resident, there will be no body fluids. I know a lot of times in the clinical setting, we do wear gloves when we're getting them dressed because they do have body fluids. But for the state test, there will be no body fluids for dressing them. So you don't want to make it harder than it needs to be. So I start by getting a report from my nurse. I asked about my resident's needs, abilities, and limitations as necessary. She has informed me that Annie has had a CVA, which is a stroke, and her left side is affected. I've knocked on the door, gotten permission to enter. I've introduced myself by name and title, called her by the name she prefers, and explained what I'm going to do. I've found and gathered my supplies, which is some clothing and a drape. I've closed the curtain drapes and doors for privacy. I'm going to wash my hands, wear gloves for body fluids, and use good body mechanics. So the first thing I'm going to do is offer my resident a choice of 2 outfits. So Annie, would you like to wear pink today or blue today? The pink? Okay. Because the resident chooses what they want to wear. I'm going to place my bed in supine position. Put my side rails up. And then raise my bed up to a workable height, about waist high. Lower the side rail on the side of the bed that you're standing on. I'm going to drape the resident. So just like with Bed Bath, I'm going to unfold the drape over the sheet and blanket. I can ask her to hold it or tuck it under her shoulders, and then I'm going to roll the sheet and blanket down to the foot of the bed. So when dressing a dependent resident, we start with the pants first, affected side first. So since her left side's affected, I'm going to start with the left side. Put the pants on the left side. And then the right side. So affected, then the unaffected. Bring the pants up to the tops of the thighs. We're going to start the arm through the shirt sleeve, affected side first, because we only want to turn them once on each side. So we're going to put the affected arm through the sleeve. We're going to turn toward the unaffected side first. So side rail up. Assist him to turn away from you toward the side rail. Bring the pants up over the buttocks on this side, so bring it up over the buttock and hip. And tuck the shirt under the resident. And you want to tuck it as far as you can so you can get it when you roll them to the other side. Bring them back on their back. Raise this rail. Walk around the bed. Lower this rail. And turn them onto their affected side. 1, 2, 3. Pull the pants over the buttock and hip on this side. Bring your shirt through and just leave it flat on the bed. Now, the reason we dress the affected side first is to prevent unnecessary bending and stretching. So remember, this is her good side, or her unaffected side. Look what I gotta do to get her shirt through this arm sleeve. You ready for the thing? We gotta bend this around, up, and through. Now, if you would have done that the other way, there is no way you would have got the affected side through that sleeve. So don't be like me and learn that part the hard way. Learn it from practicing. Dress first, undress last. Button and tie, fasten. And then to undrape your resident, bring your sheet and blanket up over. Request they hold it. Slip the bath blanket down to the foot of the bed. And then place it in your dirty linen barrel. Now just to show you, you wouldn't do this for the test, but just so you can see, after I button and such, she's completely dressed underneath the blankets. So that's how we do it, to provide for their privacy and don't unnecessarily expose them. I'm going to put my bed back down in the lowest position. Put my side rails down where I found them. And then, after any procedure, do your final steps. So A, check alignment, make sure they're comfortable. B, make sure your bed's in the lowest position. C, make sure they have their call light and water. D, ask them if there's anything else they need before you go. And E, everybody deserves a thank you, so thank your resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want their hanging curtains, open or closed. And then I your way out. I'm going to wash my hands, I'm going to do a visual safety check, report unusual findings to my nurse, and document. Thanks for watching.